guys, and welcome back to another episode of the ADH Dads. I'm your host, CJ,
I'm JJ.
and today we are joined by Dr. Janie Funk, who is the clinical director of Behaven Kids, and they focus on building hope through mental wellness in children. They work with families and kids to teach effective skills for succeeding in life, and they concentrate on that by using ABA therapy. So I'm really interested to pick her brain about what exactly applied behavior analysis is. And that really reinhelps learning techniques and improving social skills. And I'm kind of interested to see how this helps with neurodiversity and ADHD. So welcome, Dr. Janie Funk, which, by the way, is an awesome last name. So
Well, thanks. Yeah, it took a minute to get used to. It's my married name. So, yeah, at any
okay,
rate, it was somewhat more fun when I had my master's and then I was Master Funk. But
oh, I
here we
do
are.
like
So,
that. Well, I've been trying
yeah.
to curse less, so whenever I use the F word, I've been saying funk lately. So I was like, funk, yeah. So if you hear me say that a
Love
couple
it.
times throughout this.
Yeah, well, that's all good. That word's one of my favorites. So, but thank you guys for having me. I'm excited to talk with y'all and grateful you're interested in learning more about ABA and its application.
Yes. So you said you're married. How long have you been married, and what's your family look like?
Oh gosh, I have been married. It'll be 11 years this year. Uh, I don't have kids. I'm an older sister though, so that is a big part of my story. Being an older sister by my closest in age sibling is about 7 years younger than me, and then my
Okay.
other sibling is 13 years. So definitely have some experience in siblingship with some parental roles at times. But yeah, so I'm married. I don't have kids right now. I don't plan to have kids, and instead I have some dogs. So we feel pretty set.
Awesome. And what got you into this work? What kind of interested you in working with neurodiverse kids and learning
Mhm.
ABA and applying that?
So from an early age, I had a lot of interest in psychology and human behavior, why people do what they do. I had a lot of interest in my own behavior, and that's really the most intimate data we have is our own behavior and some of the introspection we can engage in towards why we do what we do. And it was always just very interesting to me, and seeing differences in how I might respond and to certain things and how others respond, and appreciating the individual tendencies and patterns of behavior, always super fascinating. So when I went to college after high school, undergrad, I went into psychology and had an emphasis in child development and child and adolescent development. And so in the specialty courses that I took in undergrad, there was quite a lot around child development, obviously, abnormal psych, and in some of those courses as well, there's a heavy emphasis on learning, so how we learn, the science of learning. Um, the intersection of those essentially led me to behavior analysis. There was several different programs I was interested in going into after undergraduate school when I was looking at applying to graduate programs. One of them happened to be a behavior analysis program. And in in considering interests in different programs and different subsections of psychology, that one really stuck out to me because I learned about the application of the science of behavior analysis to kids who had autism. There's very seminal studies and practices like clinics that were supporting kids with autism and using the science of behavior. And so I leaned toward toward that school. I got into that school, and the rest was kind of history.
So yeah, one of the things that we love to do on this show is, we started this journey about a year ago when we were both kind of sitting around and going, I think our kids may have ADHD, and we probably have ADHD, and it was right when my wife and I were trying to consider taking our daughter in for a diagnosis and analysis and evaluation of that whole process. And I said, you know what? I kind of want to go on that journey with her too, and really kind of understand that, and see where I'm at. I got diagnosed with ADHD, and her the diagnosis looked more like an ASD diagnosis rather than ADHD. So then it was kind of like we had been doing this podcast for a couple of months, trying to go on that journey and understand and find tips, tricks, tools, techniques, and different kinds of behaviors and therapy to understand what this looks like in this new diagnostic world of ours as parents. And it's really great to be the forefront of the audience members here, to get to talk to people like you and see your experience with all these different tools that are out there, and what helps our kids. So I'm really glad to have you on here and for you to explain to everybody what is ABA therapy, for our listeners that kind of aren't familiar with that term. What is applied behavior analysis, and what does that look like when working with a kid?
Yeah, great question. And and before I really dive into that, I do want to say, like, part of my process of seeing if I really, if being on the podcast and the message you both were sharing was really in alignment with my values, it very much was. So I appreciate, one of the biggest things that I appreciate about you both is being very dedicated to learning more in the service of your children, and also sharing what you learn in your experience with the greater community. So wanted to throw that out there. That's really commendable. One of the best things a parent can do for their child who has any sort of neurodiversity profile really is to learn more and be super educated about what that means for the child, what that means for their lifespan, and what your role as a parent is in that trajectory. So good on you too. As far as ABA and what that is, stands for Applied Behavior Analysis. Now, if we start at the foundation of what ABA is, it's the science of behavior. So there's a philosophical approach really about behavior, how people, not even just people, but how organisms learn, how they learn best, under what conditions is learning affected in, positive or detrimental ways, in both terms. And what are the technologies that are created from those foundations? So all of the philosophy guided the research, decades of research on how organisms best learn. Starts very basic research as in research with rats and pigeons, that kind of research. And then there's more expansion from there. After the science has an idea of how organisms learn, they progress, and the research expands to, how do humans learn? Are they any different? Are the principles of learning from this basic research any different in the expression of human learning? And then from there, there's found to be consistency. So turns out we learn with the same principles that dogs and cats and chickens do, and it's humbling but helpful in the sense that we can do a lot of good things with that work. And then as the research expands in the human domain, there's more research towards certain populations or certain behavioral characteristics. Now, behaviorism, the philosophy of behavior analysis, the science of behavior, that's really focused on what can be measured and what can we really make an impact in and measure the impact. So there's a lot of focus on what we see and how the environment and certain things in our environment affects the behavior, what we can see and what we can measure. So ABA is the applied behavior analysis. It's the application of what we've learned about the science of learning. So there are certain comparisons that might be helpful to make. So you have if you think about our medical field, right, there started to be a lot of odd, if you really read into it, a lot of odd exploration about the human body that then led to more research about how the different systems interact. And then that led to more knowledge and understanding about what different tools or interventions, from medication to like surgical kind of activities that could be used to produce certain outcomes that we want to see. Much like in the field of behavior analysis, we started with that research. There's a lot of evolution of what we know to be true about how people learn. And then we get to the technologies, like the tools of behavior analysis, how to change behavior. That's what ABA is. So there's a host of different techniques within ABA. And then the important part is the assessment, how these practitioners know which technologies or which tools of ABA are most appropriate for the given behavioral concern. So in, kind of like a broad explanation of what ABA is from the foundations to what it is now, I share that in attempt to say that ABA is just like one little snippet of a greater field of a lot of resources going into knowing how people learn.
Yeah, I guess that was kind of my next question too, is I'm curious to see how ABA has maybe changed over the years. This is, a
Mm-hmm.
quite common technique that I've heard a lot of behavioral technicians and therapists use and
Mm-hmm.
practitioners use when it comes to neurodiversity. And I'm just curious, like how it maybe have evolved over the years to how it is now, or if it's kind of using the same techniques, or where does that kind of field that you're talking about expand and start to take
Mm-hmm.
different forms?
Yeah, great question. Just with any field, there's an evolution of it. If we think back to the medical field, for example, just to stick with that parallel, they were doing things like the leeches or bloodletting or something like that as a medical intervention, because that's what they knew to be the best practice at the time. Um, there were a lot of lobotomies because there were again known to considered to be the best practice at the time, but also a different kind of cultural perception about disabilities. So if somebody's odd, probably they had, at that time they're referring to somebody who had some sort of neurodivergence. Well, out goes a chunk of their brain. But that over time has evolved as we've been more curious and our technologies have advanced, and socially we've become much more accepting of people who have differences from us or what might be considered the general population. Similarly, there has been some evolution in what behavior analysis or ABA has done to support behavior change. One thing that is worth considering is that ABA is widely known for engaging in intervening with children who have autism. That's a small fraction of what ABA has been applied to. It's been applied to organizations and culture design. It's been applied to safety, safe driving practices, environmental behaviors, how to recycle and things like that. So, there is a small segment of behavior analysis that gets the majority of the attention. There's a lot of talk recently and currently about the application of behavior analysis to certain populations, notably those who have autism. And there's talk about how that has evolved, and the history of behavior analysis may seem like it was not supportive, it was not kind. That is also worth considering in the context of, at that time, people with disabilities were being exiled. They were being institutionalized and they weren't receiving any sort of treatment. So while behavior analysis may have been, engaging in trying to change the behavior of those individuals, it was with the intention of improving their quality of life and helping them learn skills to be better integrated into the community, to not engage in such serious, intense, self-injurious behavior. But maybe the language around that wasn't what we would see now, which would be more progressive in understanding and acceptance of people who have disabilities. So all of that to say is that there's an evolution in every field. Behavior analysis certainly does have a history of, like other fields of science and healthcare, not approaching disability acceptance and awareness as we do now, with more compassion and understanding and acceptance and respect. I hope that answers your question and kind of gets to your concern there.
Well, yeah, because one of the things that I'm hearing you talk about too is like this study
Mm-hmm.
of like psychology and behavior in like a
Mm-hmm.
neurotypical sense. So I'm curious
Mm-hmm.
to see how the application is for the neurodiverse population, or what that looks like, or like what techniques or strategies are to help with destructive behavior or to change
Mm-hmm.
mindset around certain destructive behaviors.
Yeah,
Mm-hmm.
I mean, it's a good question. I went to my undergrad in psychology and, took a course on behavior and we had rats where we, had sugar water and they had to click the lever like a lot of people probably have done
Mm-hmm.
in their classes in
Mm-hmm.
college. And, that reward system is something that, is a little bit more complicated and complex in humans. And I can say that, there's been a little bit there's been pushback from various angles regarding setting up a reward and the expectation
Mm-hmm.
for a reward for like my son
Mm-hmm.
when he's having a challenging moment. So that's kind of
Mm-hmm.
something that I'm curious about, is what that evolution looks like too.
Mm-hmm. Yeah, great points. Part of the evolution of behavior analysis and more specifically ABA is the emphasis on quality of life, and also in the context of how our societal acceptance and awareness and justice and for people with disabilities has evolved. So there's a great deal of research in the field of behavior analysis around how to support individuals who have engaged in various intensities of self-injurious behavior, of um, aggressive behavior towards others, or property, in their moments of upset, or even maybe outside of their upsetting situations, but more as a sensory seeking sort of experience. And the self-injurious behavior might be how they go about meeting those sensory needs at times. So rewards a big part of that. Though I think that's part of what hinders the science or the field of ABA, is and much of it is on us. It's on the field and how we have marketed essentially the work that we do, how we disseminate the work that we do. Much of the public perception around ABA is that it's very basic, it's simple, it's too simple, it doesn't appreciate the complexities of human behavior, of the human condition. Part of the evolution of our field has been more collaboration and work with other disciplines from the medical field, neurology, more of the other human sciences like social work, towards integrating with the disability justice movement, to some degree as well. So the multidisciplinary and interdisciplinary collaboration has been huge in the evolution of our field. So while some of the technologies of ABA might be like, hey, go, I suggest putting in a token system or a reward system for your child's much how we conceptualize a sticker chart, for chores or something like that. But that truly is most often pretty oversimplified, and there's much more to be considered about what is this child physically experiencing at the physiological level in these times. How do we support around that? Motivation is huge, especially huge with kids and adults who experience ADHD, where the part of ADHD is executive function and planning and looking ahead, and foresight is super hard. There's the time blindness where time simultaneously feels like it drags on forever. But all of a sudden, here we are, it's a week later, and I have this activity due or this project due or what have you. But time flies when we're having fun and engaged in something that we really like. So that's definitely part of an important consideration of behavior analysis. So, a good behavior analyst is really considering how the child's showing up in its relations with the physical environment, the more internal environment of the child, like physiologically, how are those things interacting? What's the motivation now to do certain things? What's the motivation long term to do certain things? And then what are the skill deficits as well that we can play up and build? So it's complex because the human condition is complex. We're engaging, we're coming here right now to this table right here, this discussion, with our entire history. Our entire learning history is impacting this moment right here, but also impacting this moment right here, the technologies we're engaging with, the physiological experiences that we have, whether that's more neurological conditions, whether we have chronic pain, whether or not we're hungry, tired, sick, all of those kind of things. So it's really a behavior analysis of how all of those things interact. So if somebody is, telling you that a reward system is what you need to do to support your child through those instances, there's probably something else to the picture that needs consideration.
Yeah, a story that comes to mind throughout some of my research is, just how that sensory, those issues can show up in
Mm-hmm.
neurodiversity. And I'm thinking back to the story of this young man who's nonverbal ASD, and
Mm-hmm.
he was, one of his stim habits was punching himself in the
Mm-hmm.
mouth,
Mm-hmm.
which God, like, instinctually we all as whether you're a therapist, a parent, or a behavior technician, you see behavior like that and immediately we want to intervene and stop that. Oh my God, that's dangerous, that's violent, someone can get hurt. But he did this one day and he popped out a tooth, and that tooth was rotted
Mm-hmm.
and decayed and
Oh.
needed to come out. And that his nonverbal style of communication was, hello, something is here in here that I can't get out and
Mm-hmm.
I can't communicate about, and it took that level to understand that. And I think that, and other stories of kids that bump into stuff, or throw their shoulder or their body into the wall, and how sometimes they feel such low physical stimulation that hard movement is a way for them to go, oh, I feel something here finally, or
Mm-hmm.
I'm getting, though it may look abrupt to us as a neurotypical person watching them throw their body into a wall, it's a way of understanding their feelings, their senses, and who they are as a person, what it takes to feel and react to certain environmental stimulus. So I feel like that's like such an important part of understanding the neurodiverse community, is taking the time to really like dive into those tendencies or those stimulations that we don't understand, even when they
Mm-hmm.
do maybe look dangerous or violent, or so anyways, that just kind of makes me think about that, and just how everybody's different and needs a certain level of empathy and curiosity. to decide what the next level of action is, right? Or what the best therapy is, or what the best tool or technique is.
So yeah,
Yeah,
is there
absolutely.
a certain type of roadmap to, for parents with a kiddo with neurodiversity to come to ABA therapy?
There sure can be. Some people have experiences with ABA before they really even understand or come to know or realize that their child is also experiencing some sort of neurodiversity, or even just a behavioral concern that might benefit from more deliberate or intentional support with ABA technologies. Um, but what a great illustration, CJ, of how important it is to be really curious in your approach, how important it is to really assess all of the things that could be happening. As you know, you described that child who's hitting his jaw. It turns out he had a tooth issue, a literal health problem that was contributing to what we were concerned about behaviorally, and had, you know, maybe now going forward there will be a little bit more curiosity about what what that child is communicating with respect to a given behavior that's presenting as somewhat concerning or abrupt or intense or just generally different how we experience our own bodies. So that being said, as far as how parents or caretakers can come to be at a place where they're deciding therapies that are appropriate for their child, or other interventions. It could be behavioral therapy or therapy by medication, and those sorts of interventions too. Just the importance of curiosity and some some skepticism as well. So if you're engaging with providers at this point, you've sought out an assessment that may or may not lead to a diagnosis, but there's some sort of reason why you might come to a diagnostician and say, hey, here's what I'm concerned about. What do you see? What are we working with here? Uh, those those situations may or may not lead to deciding what kind of therapy to move into, or maybe it's more of a delay in certain developmental areas, but it depends a lot on the provider and the competence and the experience of your provider, turns out, as to what they will recommend. Uh, we see this all the time with, just general medical concerns that we have with our body. You can have a great provider that really values and has a close eye on preventative steps that can be taken, or you can have some that are not staying up to date with current practices and recommend the same option that they did 20 years ago, despite all of the medical advances. So, it depends a lot on the competence and the skill of your provider. Unfortunately, truly, thankfully, with technology, there are some benefits to that, or you can go and you can look and you can research and you can ask. We have a lot of social media kind of networks where our communities now are not limited to our physical communities, but we have others around the world who may be experiencing similar things. So there's a lot to be learned. There's a lot to sort through. So you do have to have some skepticism as well. But as far as ADHD, certainly it stands true at this point that the most evidence-based intervention for that would be the combination of medication and behavioral therapy. It's hard. It's hard. Parenting is hard. This is just another example of a situation a parent is in where they have to figure out what's the best decision here. And, sometimes you don't get it right, but
Yeah, no, you don't.
evaluate as
That's,
time goes on.
I mean, that's been both JJ and I's experience in our journey, in our own separate journeys. We've had a lot of we've had to seek out different opinions and gather information from multiple sources. Where man, I just growing up as a kid, and my grandparents too, they had the mentality like the doctor is all knowing, right? Like,
Yeah.
you believe, if there's anybody to believe, it's a doctor. Okay, he went
Mhm.
to 8 years of medical school. You believe a doctor,
Yes.
where I think that the mindset has kind of evolved over the years of like, well, you
Mhm.
should get a second opinion. Maybe you want to get a third opinion. And I
Mhm.
think that like we really need um, to arm ourselves with that and to really like be open to having those different
Yeah.
perspectives rather than just one person's opinion, because
Mhm.
we've had experiences between the two of us, JJ and I, of you need to put your kid on medication to what is autism,
Mhm.
to so if we're just trusting one doctor's word about the future and care of our kiddos, I think we're
Mhm.
doing a great disservice to them and ourselves and their potential, because it really does take understanding of a lot of different ways and techniques and how to apply those or little bits of those, or how to kind of
Mhm.
franken technique our own technique together to individualize what our kids' own needs are in this world of you got
Mhm.
to do this, you got to do this, you got to do this.
Mhm. Yeah, and then balance it with all of the misinformation and disinformation that's out there that can actually be harmful. So it's tough,
Sure.
but certainly encourage curiosity and ongoing exploration, evaluation of what your child really needs. Like, you all are generally the people who have the best insight, given the amount of time you're spending with them. So while you can go to the most experienced expert in the field, there's still going to be a degree of how do I tailor this intervention or treatment or therapy modality to the needs of my child. And you may have two children with the same diagnosis, but the technologies or the tools or treatments that you use have to be different and individual to those children because their support needs are different. They're coming to the table and engaging in their world with different um, skills and challenges that they're experiencing. So go to the best doctor or expert, and you're still going to have some degree of that Frankensteining, as you mentioned, of what's going to work best. That's one thing that's really good about behavior analysis, actually, is that we're all learning from the same principles of behavior, but there's a lot of options and opportunity to really combine different ABA techniques to really fit the individual needs of the child, and also consider the individual needs of the child across different settings too. So the support needs might be different at home, they might be different in school, they might be different at summer camp, and ABA lends really well to that.
So what is Behaven Kids? And I'm curious,
Mm-hmm.
like, how do people in your network? You're in Omaha, right, Nebraska?
Mm-hmm.
And I'm curious, like, how do people seek you out, or how do they get hooked up with you? Is there a resource center, or is it a
Mm-hmm.
referral, from a primary care? How do people get involved with Behaven, and what does like the whole program kind of look like there?
Sure. So Behaving Kids is an organization that's been around for several decades, and with the intention of really serving the community in Omaha, but also greater. So headquarter out of our base in Omaha, and we're servicing Lincoln as well, and then some other smaller, more rural areas. People will come to us for services as well, but the intention of serving our community towards supporting mental and behavioral health. So the agency itself was really founded with the intention to serve as sort of a middle ground support for kids who are experiencing behavioral challenges that precluded them from like the standard daycare setting. And also their support needs weren't so high that they needed to be receiving like inpatient treatment or something super structured like Boys Town, for example. So the specialized day program was designed to serve as that more middle ground. So it's like a daycare setting of sorts where there is some structure and there's routine and there's some behavioral supports and curriculum for learning things that are important to children at that age, in combination as needed with mental health therapy. So a really unique community offering in filling some gaps that we needed here and that parents and families needed here. So for many years, it was the specialized day program and mental health therapy, and really supporting both behavioral and mental health in those formats. And then more recently, the ABA program was developed, and that was more to support the kids and families in the community who were experiencing autism. So one thing that is important to note is that ABA therapy is primarily in this nation covered a covered therapy only for autism, despite its applicability to other behavioral related concerns, whether it's at a more diagnostic level and meeting diagnostic criteria, or just general like recycling behaviors, like I mentioned earlier. However, because of that reason, that's also why we're really widely known for the treatment and therapy towards autism. It's because insurance funds it. So we get a lot of referrals from practitioners in the community. There's also word of mouth as well. We've been around for decades, so there is a knowledge about the services that we've provided and what kind of gaps in the community we have filled for so long.
So one thing that we've been a little bit curious about is that there's been like some pushback on the idea of ABA therapy for ADHD and autism. Like the idea is the emphasis on routine can sometimes limit a child's ability to adapt to new or unexpected situations. Like, what are some of your thoughts on that?
You know, I agree with that statement. If your focus is solely on routine, then you may have some problems with generalizing. We're humans. Our human condition is a little bit messy, and life is a little bit messy. You know, you're never going to only have the same routine and grow up and live a life with the same routine. So where routine becomes really important with ABA is in the sense that we need to have a little bit of consistency to be able to tell what parts of what we're doing as far as what supports we're implementing are actually having a desired effect or not, so we can adjust. So routine is important. It gives some consistency in that manner towards evaluating what's working and what's not. And then for some kids, it is really helpful to have some routine. Routine can be super important and supportive for people who experience ADHD. Especially in consideration of the different executive functioning challenges that we have around planning and conceptualizing time, and the delayed consequences of our actions being less controlling over what we're doing now. So it has its place, but for our skills to really be super meaningful for us, we have to be able to know how to apply them in different settings and in different situations. So an ABA therapy may emphasize routine. However, there should also be planning for expansion of that routine. Tolerating, so to say, when our routine is disrupted, because man, I hate it when my morning routine is disrupted and then I'm late, but that's real life. So how do I cope with that? And maybe what needs to happen with my routine to adjust it to prevent that from happening again. So routine can be important, but flexibility too. That's one term that the field uses called generalization. How are we generalizing what we know to different times and settings and situations?
Well, I'm curious how what those talks look like, because, man, I fall into that trap all the time as a parent with neurodiverse 9-year-olds, because she's she's got almost like an oppositional defiance kind of expression in her autism. So everything is no, but right away, right? Like she has to like, no, but what if we were here and you were there and then, the power went out and the clocks didn't tell me what time it was and I didn't know. She can find like the loophole, like in any scenario to like figure out, well, that rule may not apply in this case, and that and the times that I can dedicate my patience and my time and my mental stamina to answering those questions and going through those with her, she really can understand it moving forward and getting through it the next time. But there are times where I don't have the time or patience to do that, and we have to put the shoes on, and we can't have the conversation of why it's important to put the shoes on, even though we've had the conversation about how socks feel to her, and how we can't get past that sensory thing, but every day it's the same talk with the shoes, but she hates socks and she wants to know why she has to wear them, and we try to understand the like social expectations and the educational system standards of dress code and why they say you need to, but it doesn't always work, right? Like there are times where I'm just like, I throw my hands up and I don't have the time to go through the 20 questions game, and I don't have the time to to lose my temper and have a meltdown over this to get her to get motivated. So what does the middle ground look like, or what do conversations with clients that exhibit some of these behaviors or don't want to do a hard part of their routine, like how can we motivate them to have the comprehension and understanding and motivation to do it themselves, rather than having to be told by an alarm clock, a behavioral technician, a teacher, or a parent what the next thing is to do.
Oh gosh, that's such an important consideration because you're so right. You cannot generate enough rules to account for everything. It's impossible. So that can cause a lot of frustration for everyone involved. What these conversations go like for me with the people who I support, it is really rooted in what's important for the child, what's important to the child. Sometimes those things don't match up. There may be some rules or social expectations in various degree of seriousness about wearing socks, for example. It also it really begs the community and society to be a little bit more considerate and flexible in their expectations too. So, some of these quote unquote problems that parents are experiencing, and I get it, a problem for sure, it is how it comes up. There's a struggle to get through a routine. It's hard. Nobody is having fun. It's impacts a lot of things, even though it's just, putting on your shoes, for example, in the morning, can really bleed into other things in our lives. So I'm not saying it's not a problem, but I do question, why is it a problem, and what can our society and our culture do to be a little bit more gentle about the expectations? So important for conversations and questions are really good. As caretakers, it's super important for us, as you both know. I've heard you talk about it before. The forethought, anticipating what might be challenging for the child in the situation, or the family unit and the situation, and thinking ahead as to, well, what could I be flexible about if I know this particular thing is consistently challenging for my child? If I'm being honest, is it important to really insist that it happens this way? So a lot of supporting a child who has any neurodivergence or even just strong preferences, it's really helpful for the child-parent relationship to take into consideration, what can I be flexible about, and then how do I support the child around what there's not much flexibility about. If there's some social consequences of not wearing socks with your shoes, and I'm sorry, CJ, I'm sticking on that example, and I'm not talking about this to criticize your parenting in this situation. But for the sake of example, if it's not a rule at school for the dress code or something like that, that the child needs to wear socks, they may have stinky feet, they may get blisters, it may look a little weird depending on the season or the style of shoe, but in the bigger picture, is that okay? Yeah, I guess I might,
Yeah, yeah.
ask the community or the peers or my family members to be a little bit more accommodating of preferences. But on the other hand, there's times when socks, you got to wear the socks. It's cold out, you got to wear the socks. These shoes give you horrible blisters. My child doesn't have a lot of attention paid to the pain that it seems they'd be experiencing. They don't notice when the blood's coming out. So to protect you from frostbite or extreme blisters, I'm gonna have to have you wear the socks. Bummer. And then going forward, like, how do I make that a little bit more comfortable for them? So I just say, demands
There's just certain
flexibility.
things we gotta just let them figure out
Mm-hmm.
with those natural consequences,
Mm-hmm.
and before we even got a diagnosis, even, but it was in the
Mm-hmm.
really early stages of getting diagnosed. We were talking with her therapist, and we were dealing with this. She won't use utensils during dinner,
Mm-hmm.
and my wife was so stuck in this habit of, like, when we're out eating at public, like, at home it's one thing, but when we're out eating at public, like, everyone stares.
Mm-hmm.
I feel like we have to, and it's just
Yeah.
such this brainwash that we experience from society and culture,
Mm-hmm.
and our what really kind of put it in perspective is the therapist said, as we're going through all of this, and she has a meltdown every time you ask her to, use a fork, and, like, she has to use a fork. And the therapist said, like, well, is the fork really worth it? Is
Yeah.
it really
Yeah.
worth the 4 hour meltdown that you're going to have, and
Mm-hmm.
the conversation, and
Mm-hmm.
how everyone's night has to get abandoned to now deal with this thing and explaining it to a neurodiverse kid? Is it really
Mm-hmm.
worth it? So now we all just eat with our
Mm-hmm.
hands at Chili's, or just, we look at the
Why
old
not?
lady at the corner and we say, screw you, we just,
Yeah.
but,
Yeah.
I think that those creative solutions do really offer themselves to us if we're open, but
Mm-hmm.
sometimes we're just, like, so locked into, like, building a
Mm-hmm.
wall up of self-defense from the
Yeah.
outside, like, perspectives and opinions on our life, that we really, like,
Mm-hmm.
forget to, like, take a step back and a breath and see, like, what is the creative solution here,
Mm-hmm. Mm-hmm.
and yeah, the sock thing is, I bring that up because I've heard that brought up with a lot of families and a lot of different
Mm-hmm.
situations, and
Yeah.
we have found that creative solution. We found some sandals there, but they look like shoes, so they
Mm-hmm.
still get some nice airflow in there, so she's not getting stinky feet, but she's she's still adhering to school dress code of closed-toed shoes, so
Mm-hmm.
those, they really are out there. And if I'm saying anything at all other than just rambling, I guess my point would be to the parents that are listening to this is, like,
Mm-hmm.
don't, as hard as it is, like, be open to what your solution is for your family, your situation,
Mm-hmm.
for yourself, rather than worrying about, like, all of those outside opinions trying to take shots at you,
Yeah.
because that's where I really think the success is in a parenting, in a situation that can be as unique and challenging as someone with a neurodiverse child. And
Mm-hmm.
it's not, the ABA guy who made up ABA therapy said, this will work for your child, or for the other types of therapies are. It's like,
Mm-hmm.
you know, what works for you. And you got to be real
Right.
comfortable with experimenting with that, being curious and empathetic about that,
Mm-hmm.
and
Mm-hmm.
not letting those outside opinions affect what works for you. And
Mm-hmm.
so, I don't know. I'll stop
Yeah.
talking now, but
No, no. Great points. I mean, gosh, how hard is it for us to come to a parenting situation and not refer back to how we were parented or how we were raised or how we were supported or not in school or in our peer groups? we're bringing that experience to the current moment, and it takes a lot of growth and self-reflection and practice to be able to identify, what's coming up for me personally versus, what do we need to do in this situation with my child. So hard, demands a lot of growth as a parent generally, uh, let alone parenting a child with a neurodivergent condition. It's hard to do. When I was growing up, I grew up in a very rural community. I didn't have a lot of exposure to disabilities. And when I moved away, and certainly when I became engaged in a field that really primarily serves those with disabilities, it was very eye-opening to me. And thankfully, I had some guidance and great mentorship and personal support to be able to engage in that self-reflection about my own biases, about accommodating individual preferences, whether you're neurodivergent or not, but then certainly with respect to the accommodations for disabilities in general, be that is a physical disability or a mental health condition that somebody's experiencing or a developmental disability, it it really is important for us to be thinking about how we were socialized, how we were parented, how we experienced the education system, and evaluate whether or not that's coming up for us in our parenting and how we're supporting our kids. I mean, the kids are going to get enough frustration in their environment. How can we buffer that? How can we be a protective factor for them so that they don't feel like they're the burden of everybody's life? It's hard.
It is hard, and my example is this. I mean, I think it's so easy to try and create a scenario, a future fiction story, whatever it is we're telling about this situation, to try and remedy it by making fear
Mm-hmm.
a part of that.
Mm-hmm.
My son is somebody who every night will generally be upset about the idea of doing homework. So
Mm-hmm.
he knows that it's coming up. He knows that it's part of the daily routine, but he's also worked in his own magic where he says, I had a tough day. Can I not do that? And if you give
Mm-hmm.
in,
Oh.
then you know what's going to happen. Tomorrow could
Mm-hmm.
have been a great day, but as soon as homework comes around, I had a tough day. Can I skip it? And then, when he has the harder days and he really just doesn't want to do homework and he actually is, in tears because he doesn't want to do it, part of me tries to come up with, again, that fictional future story for him, saying essentially, this is part of your job as a child. This is what you do for your work, and I do my work every day. And the reason why I do my work is so I can provide for the family and we can have a home and we can have food and stuff like that. And that's essentially what you're trying to build yourself up to. But he is in a day-to-day mindset with it.
Mm-hmm.
So
Mm-hmm.
he wants that instant gratification, the 2 marshmallows for, if you wait for a while, you'll get the 2, or
Mm-hmm.
you can get the 1 right
Mm-hmm.
now. He's still in the mindset of, I want the 1 because I'm immediately gratified here.
Mm-hmm.
And that's the challenge that I face, because I know that I'm still thinking toward the future. And what I grew up with was very much that fear tactic. Well, if you do
Mm-hmm.
this and this is going to happen, and it's,
Mm-hmm.
you're going to end up a crack whore. Obviously, that wasn't what that parent said, but they
Mm-hmm.
did give me that constant fear-based story to try and get me to do something that they wanted me to do, or that they recognize I should be doing based on, whether it's academia or whatnot. And I would like to find a way to create something positive around that. And of course, with
Mm-hmm.
neurodivergence, one of those things has been the reward system. But I don't
Mm-hmm.
want that to be essentially what my child is aiming for. So that's been my challenge, because there are all those factors. There are all those possibilities. There's my parents and how their influence is on what I do today, and what it
Mm-hmm.
is that my child's individual needs are in the moment. He might be in such a difficult spot emotionally that doing homework is actually hurting his tonight. But then that
Mm-hmm.
applies to a future scenario where he's actually doing fine and he just wants to play. That this is
Mm-hmm.
this is the scenario that I deal with from a week to week basis.
Mm-hmm. Oh gosh, JJ, you, everybody. That is such a common struggle. And I think we were honest with ourselves, we probably say that, yeah, that's pretty relatable. But you know, some things that come up for me in that situation is that it's real life, that sometimes work sucks and we're just in a situation where we kind of have to, we're kind of stuck in this job that's not the best fit for us. It doesn't really align with our interests or our strengths, and man, so hard to get through that. But as you mentioned, sometimes you know our hands are kind of tied, and I think that is something that's really cool to see parents modeling. Actually, is just kind of the validation of, you know, man, I had kind of a rough day, or I'm not feeling well, or both, or what have you. And in those circumstances, I'm going to adjust what I do a little bit. I might compromise over in this area, but at the end of the day, I still have to get this project done, or get this task done, or get through the workday. And in order to support myself to do that, I'm going to make adjustments in some areas. It's like modeling the appropriateness, and that it's okay and healthy to make some accommodations for yourself. You know, even if you still have to get through the workday, you know, maybe you're going to lower your expectations a little bit. But you're right, you can get into this arrangement where you're really not ever having your child come to the homework table like stoked to give 100%, and that may be your reality. There are some also, you know, some things that you could do with your reward system. There's a lot of feedback and thoughts about ABA's use of rewards, and that it takes out like true motivation, because my kid only has to work for this toy or for screen time or things like that, but don't appreciate the actual concept of being able to provide for my family one day. However, the real impact of having these contrived or programmed or otherwise, you know, not really natural consequences to getting movement towards certain accomplishments is that with enough practice, there will also be some natural consequences that they will experience. And so you can fade out these marshmallows and or stickers or allowance money, screen time, what have you, so that those are driving the behavior you want to see less, and more so it just becomes part of their habits, so to say, or part of their routine, something that has over time with practice become less uncomfortable or less of a drag, less of something they hate, because they've been able to experience some of the reward of it. It's tough to get that ratio right. You got to play
Yeah,
around with it sometimes.
and I'm curious if you have like a story of a breakthrough that you've
Mm-hmm.
witnessed. You know, when you get to that point where that starts to turn and you see that new habit, that new success from day to day form. You know what that looks like, and you know if the patients, like especially somebody with autism, you know, emotional expression sometimes seems to be something
Mm-hmm.
that's less outward, but you know what that looks like for them, how they experience that happiness in that.
Mm-hmm. There, you know, the work that behavior analysts do is not super easy most of the time. You know, I guess arguably like with most jobs, but the real rewarding part of it, I think if you asked any clinician about what keeps them in the field and what keeps them at this job and doing the work that they do, is the impact that they see on the kids and the family. For me personally, what I love most is seeing through really hard work on behalf of the family and the individual with autism or ADHD, uh, putting in the work over time, really making some progress. But in combination, like I love to see skills being built. So especially around communication, where, you know, maybe historically the child was really communicating by means of hurting themselves or hurting other people, to where now they can use a picture icon system or sign language, or they can vocalize or point to be able to get their needs met. That's huge. And the impact that has on the family is awesome. But how we were talking about earlier is around like the expectations of the community and the family, and being supportive and accommodating too. I love to see that, because it, as I mentioned, the child's going to get enough judgment, critique, rejection from the wider community throughout their life, that if our families can be super supportive and accommodating and accepting and unconditionally loving and believing in our children, that is so impactful for the child's trajectory. So I love to see some mindset shift in combination with skill development with the child. It's so
Yeah,
powerful.
us too. That's why we're doing this. That's why
Mhm.
we started this podcast, to make neurodiversity typicalized. That's a word, JJ. Don't look it
Mhm.
up. But we really, I think, that's what keeps me going with these episodes every week, and why I want to
Mhm.
continue doing this work is, when I first entered this field and started going down a road of diagnosis, it was like, so, oh my God, what do I do with all of this
Mhm.
information? Or how do I understand this? How do I digest this? Which way is the right path? And
Mhm.
I just like, there is no right direction. Taking a step just in any direction, I think, is a really great
Mhm.
way to start meeting people like yourself and other really informed people, to build a community and to build a network of
Mhm.
understanding. So thank you for coming on today and doing this, and helping us kind of further that journey, and for helping our listeners understand this, and for helping kind of get the word about neurodiversity and the special needs community out there, so that we can maybe have an experience, a mindset shift around how we interact and our understanding of this. Because I was there too. I had a lot of guilt and shame, I think, when I got
Mhm.
our diagnosis in our family, of like how I had previously understood a lot of this information, or people
Mhm.
with these conditions, or the
Mhm.
expressions of those conditions. And it was very humbling and
Mhm.
rewarding, honestly, to start learning this information and see that, like, perspective is so diverse in its understanding, and everybody has a different and unique and special perspective of how life is and reality works, and their experience of it. So
Mhm.
thank you again for coming on, and helping widen that view of the world, for everybody and for myself.
Well, thanks very much for the invitation. It has been a pleasure. I truly appreciate what you all are doing again, and I'm grateful for your dedication to learning more, to doing better. That's all we can do as humans, is to be open to growth and doing better next time. And us as as parents, as caregivers, as supportive individuals in others' lives, normalizing mistakes and learning from those and doing different next time, and saying sorry when we need to. That's on us. That's what we can do to better serve the world, our families, and you guys are doing a great job with that. So thanks a lot, and I love and appreciate the work y'all are doing toward that.
Thank you, and you too. Before we go, though, is
Mhm.
there anywhere where our listeners can reach you out, or get to know you better, or ask you questions involving this, or even some Omaha locals that may want to get involved with Behaven or get more information? Is there somewhere that they can reach out to you?
Yeah, absolutely. So for me personally, professionally, I have a little bit of a presence. I'm at least responsive to messages LinkedIn. And as far as Behaven Kids, you can certainly go to our website. Even if you aren't local to Nebraska, we also have some good blogs that provide tips and information for parents of kids who have any mental or behavioral health challenges. So you can certainly go there for some resources as well. And that's behavenkids.com. And it's
Great.
BEHAVEN. And our logo's the B with the two B's. So you Google it,
Wonderful.
it'll come right up. But yeah, thanks for
Yeah, and
asking.
I'll put that in the show notes for you guys too, so don't worry about that. And
Perfect.
thank you, Janie. Looks like JJ may have been having some internet problem. He dropped out on us, so I'm going to ask your help doing the outro today. So after I see it, say
Sure
my
thing.
name, you say yours, okay?
All right.
So thanks for listening, guys. It's been another wonderful episode of the ADH Dads, and I'm your host, CJ.
Joined by Dr. Janie Funk.
All right. And until next time, guys, really looking forward to having you back. Thank you, Dr. Janie Funk. Funk, yeah.
Funk, yeah.